The Affordable Care Act recently became a major topic on the campaign trail. Premiums for some plans will increase next year by an average of 25%. That's more than 3 times this year's hike. In today's installment of our ongoing series, Issues That Matter, we look at the presidential candidates' plans for health care and the future of Obamacare.
I've also said I will defend and improve the Affordable Care Act, and for me, that includes giving Americans in every state the choice of a public option health insurance plan.
Trump administration will immediately repeal and replace Obamacare.
I am committed to making sure that people retain coverage that they can afford, and that is going to require taking on premium cost and deductible cost and prescription drug cost.
Our replacement plan includes health savings accounts, a nationwide insurance market where you can purchase across state lines, and letting states manage Medicaid dollars. So much better.
And I'll say something about the Affordable Care Act, which he wants to repeal. The Affordable Care Act extended the solvency of the Medicare Trust Fund. So if he repeals it, our Medicare problem gets worse.
A vote for Trump is a vote for America first, and is a vote to protect Medicare and Social Security.
And when we find unjustified spikes in the prices of long-standing life-saving drugs, we should slap penalties on companies trying to cheat people who need those drugs.
Reforms will also include cutting the red tape at the FDA. There are over 4,000 drugs awaiting approval, and we especially want to speed the approval of life-saving medications.
We're going to do everything we can to catch up to the rest of the world. Affordable child care, paid family leave, earned sick days.
By recapturing fraud and improper payments in the unemployment insurance program, we can provide 6 weeks of paid maternity leave to any mother with a newborn child whose employer does not provide the benefit.
Joining us now to talk about these issues are Dr. David Agus and Steven Brill. David is a cancer specialist, professor, and best-selling author, and a CBS News contributor. He's on a blue-ribbon panel of experts advising Vice President Biden's moonshot to find new cures for cancer. Steve wrote a book on our high-cost healthcare system called America's Bitter Pill. We're pleased to have both of them here. David, let me begin with you. Costs are up, premiums are higher. Insurance companies are backing out of participation in exchange programs. What's going on? Is it not what we thought would happen?
Well, the principle was right, is that we need health care for people. It's a right in our country, and we should have a right to health care. And Obamacare accomplished that. 20 million people now have coverage who didn't have coverage. But one of the premises is that young people who never get sick would enter the system, contribute their dollars, and it would subsidize the people, because as you get older, you get more and more ailments, and they would start to even out. These young people said, listen, I'm just going to pay a fee. I don't want to enter because the prices are going too high. And so when you don't have that angle, that seesaw tips, and that's what we're starting to see now.
So what's the solution?
Well, the solution is you don't throw it out, the baby with the bathwater.
Do you think it works for the most part?
I think it's great to get 20 million people with health care. And obviously it works depending on who you talk to. But any policy needs to be refined. You can't just put out a policy and it's going to work from day one, especially something as complex as health care.
But this is not what they... Go ahead, Norm.
Well, so that's Obamacare,
yes,
right? The challenges that still face Obamacare and the opposition to that. But for beyond that, the question of health care, which is 1/6 of the U.S. economy, premiums are going up for those of us that aren't even on Obamacare.
Yeah, exactly.
In my particular case, our premiums went up over 30% this year. How is that justifiable?
Well, it's justifiable if we continue to be the only country in the developed world that doesn't control the price of prescription drugs, that allows so-called nonprofit hospitals to make exorbitant profits, charging ridiculous prices and paying exorbitant salaries to its non-doctor executives. Let's remember that all the headlines about the exchange, those premiums involve maybe 3 or 4% of the country.
Right.
And Obamacare was meant to give those people health insurance coverage. So if you repeal Obamacare, the only thing you're doing is you're taking away their coverage. The rest of us, Obamacare did nothing for except the reform of making sure that insurance companies could not exclude us if we had any kind of a pre-existing
And
condition.
forced insurance companies to cover more preventative things,
Right.
which helps
which
women.
naturally raises that has to raise the premiums. But let's remember one thing. Let's take a step back. The insurance companies, as absolutely miserable as they are when it comes to customer service, they're opaque, they're terrible, but they're on our side of this equation because they pay the same exorbitant bills that we pay. So talking about insurance reform does not get to the core issue of talking about the fact that healthcare costs too much money because the prices are higher than anywhere else in the country for every single thing we do with healthcare, and everybody involved except the doctors and the nurses is making way too much money.
Okay, let me just do two things here. One, what's happening to health coverage in general, the point raised by Nora. But secondly, just tell me one more time, is Obamacare doing what it was promised to do?
Obamacare promised to do two things. It promised to make healthcare more accessible to more people by giving them subsidized insurance coverage. It did that. It also promised kind of vaguely, because it was a promise they could never keep, that it was going to do something to control the cost of health care. It has done nothing to do that. And frankly, most healthcare experts were saying that at the time. I was on this show a couple of years ago when my book came out, and I said it's going to do nothing to take care of the cost of health care.
David, why aren't
I see a solution.
Why aren't either of the candidates talking about then addressing the rising costs of health care that affect everyone, whether you're on Obamacare or not?
But let's be fair.
Well, Hillary has talked about it a lot.
Let's be fair. Drug costs are less than 10% of health care.
That's wrong.
So that's right. It's the CDC figure.
Drug costs on your personal bills are 10%. Drug costs in hospitalizations look like they're hospital costs. That's another 10%. Okay. So it's 20%.
Whatever the numbers are, they're not all of health care. And what we're seeing is 5% of people spending 50% of the dollars in the Affordable Care Act. And so a number of people who are very ill are taking a disproportionate portion of the resources. So one of the things we have to talk about and get to is to get those people into programs so they don't spend so much. And that's how you can really reform health.
But that's not just Obamacare. That's true in general.
And it's not new. We've known that.
We've known that, but we're seeing those figures jump out at us, and that's what we need to really address.
Well, that's because people are getting older, and we still have the same system as before, which is the more tests a doctor does, the more exams, the more everybody gets paid. And Obamacare does have some pilot projects that try to go after that. They haven't really been successful so far. But the core issue is we have to do something about the price of health care. It is a monopoly market. And if you have a cancer drug that you need, you're going to buy it, and someone's going to be forced to buy it for you no matter what it costs.
Just quickly, the issue of paid family leave and sick leave. Donald Trump supports that, that issue as well.
Well, except in the companies that he runs. He doesn't support it there.
But he has supported it as a candidate.
He supports it as a hypothetical, like a lot of other things.
Okay. Thank you.
I think the summary really is that Affordable Care Act help people. Both candidates want to change it, but this is a bipartisan issue. Healthcare is not partisan, and I think that's really the message.
But politically, it's very partisan.
It's partisan because you've got abortion, yes, no. It's partisan because they want the term Obamacare kicked out. No matter how you do it, you're not going to be able to remove healthcare from 20 million people. So the parties have to work together.
It's not going to be repealed.
It's not going to be repealed. Thank you, Steven Brill. Thank you, David Agus.